goodbye. I want you to hold out the palm of your hand. Why don't we leave it at that? Nothing to say, and everything gets in the way. Seems you cannot be replaced, and I'm the one who'll stay. Oh, in this world, it's just us. You know it's not the same as it was. In this world, it's just us. You know it's not the same as it was. As it was. As it was. You know it's not the same. Answer the phone. Harry, you're no good alone. Why are you sitting at home on the floor? What kind of pills are you on? Ringing the bell, and nobody's coming to help. Your daddy lives by himself. He just wants to know that you're well. Oh, in this world, it's just us. You know it's not the same as it was. In this world, it's just us. You know it's not the same as it was. As it was. As it was. You know it's not the same. Go home, get headlines, feed internet. I don't wanna talk about the way that it was. Leave America, 2 kids follow her. I don't wanna talk about us doing it first. As it was. You know it's not the same as it was. As it was. As it was.
Good afternoon, and thank you for joining us today. I really appreciate you taking the time of your busy day to spend with us. This webinar is in conjunction with Cardinal Health in collaboration with Norm. Today, we're going to discuss 3 ways to strengthen your rheumatology practice's revenue cycle. Next slide. Just a few housekeeping rules. Submit your questions anytime in the Q&A section, and we will have time at the end to answer those for you. The webinar will be recorded and shared afterwards. And please complete the brief survey question upon exiting the webinar. Thank you so much. Next slide. So I want you to meet our speakers. First, I'm Andrea Salakis. I'm the Executive Director of Norm. So thank you, and I'm going to turn it over to Heather.
Hi, good afternoon. My name is Heather Walton, and I am Director of Revenue Cycle Management at Cardinal Health. In my current role, I provide revenue cycle support to specialty physician practices through technology offerings and consultative services. Prior to joining the Cardinal team, I actually spent over 20 years leading physician practice revenue cycle operations for both hospital system medical groups and private practices. I'll turn it over to Robin.
Hi, my name is Robin Brown. I'm Director of Provider Solutions and Technology at Cardinal Health. I was tasked with launching the payer contracting program that we offer at Cardinal. And prior to my work at Cardinal Health, I led payer contracting programs as part of my role at a large hospital system that spanned the United States. Rosie, could you introduce yourself?
Sure. Hi, I'm Rosie Walters. I'm practice administrator in Louisville, Kentucky. I have 7 providers, a 9-chair infusion center. Before entering rheumatology 12 years ago, I was in gastroenterology.
Hi, I am Chris Cagle. I'm the lead biologic coordinator at Tri-State Arthritis and Rheumatology, located in Northern Kentucky. We are a medium-sized practice with 6 physicians and 2 mid-levels. I have been with the practice since 1990, but before you start doing the math, I was 10 years old when I started. Back to you, Andrea.
Next slide. I just wanted to give you a quick overview of our webinar today. We're going to highlight some best practices for strengthening your rheumatology practice revenue cycle. This is really important to all of us. We're going to leverage robust data analytics and monitor key performance indicators, simplify payer contract negotiations so you can gain maximum reimbursements, and streamline the prior authorization and accelerate speed to the therapy. So here we go. On to you, Heather. Next slide.
Great, thanks, Andrea. So delivering high quality patient care is what rheumatology practices strive for, and the revenue cycle plays a significant behind the scenes role to make that happen. From patient registration all the way through a $0 balance, practices like yours often employ teams of specialized individuals to maneuver through that maze of connected processes and workflows and across multiple systems, all to ensure that timely and accurate payment is received. And you all know that if a critical step along the way is overlooked, denials come in place of your payments and your cash flow is impacted. I imagine this probably sounds familiar to most of you. Without an optimized revenue cycle and the ability to keep your finger on the pulse of your AR, practices like yours are really challenged with not knowing exactly where the breakdown occurred. So what does it really mean to have an optimized revenue cycle? I really thought about how to articulate this in a concise way. And while it's hard to summarize, I would like to hit on some of the essential steps that can help make a difference. So I really think that having an optimized revenue cycle means that your critical processes and workflows are connected with clean handoffs to prevent things from falling through the cracks. And this really begins with making sure your patient demographic and insurance information is correctly captured and that your benefits are verified before your patient is seen. And this helps to ensure coverage is in place, patient financial responsibility is estimated, and that payer or plan-specific medical policy guidelines are really understood. It means that your scheduled services for drug administrations are proactively reviewed to ensure that buy and bill is allowed and that authorizations or referrals are in place. Services should also be documented when provided and your charges entered on the same day. It's also very important to have a reconciliation process in place that ensures that all the services that you've provided, especially those high dollar drugs, have been captured and billed. So once your charges are in, your claims need to be submitted timely and electronically, including your secondary claims whenever that's possible. And they also need to be proactively scrubbed against things like CCI edits, Medicare national and local coverage determinations, payer medical policies, and any payer-specific claim requirements that are out there, like having prior authorization numbers, NDC numbers, or referring provider NPIs on your claims. And taking these steps will allow you to fix your claims before they go out the door, which in turn is going to improve your clean claims rate and then expedite your cash flow. Speaking of cash flow, you need to resolve your denials timely and make sure that you understand at the root cause level what caused them so that future issues can be prevented. And one other piece that's sometimes overlooked is payer contracts. And these should be kept up to date so you can maximize third-party reimbursement. With that, it's important to have a mechanism in place to capture those rates, compare them to the payments you're actually receiving, and then calculate payment variances. I like to say that getting paid is good, but getting paid right is best. And finally, it means that you regularly measure and monitor your performance through timely reporting and tracking of key performance indicators, because just when you think you've got it all figured out, something changes, like a new medication comes to market, a key staff member resigns, or a payer makes an update to their policy that you weren't aware of, and then you're right back to the beginning, plugging holes in an attempt to prevent it all from caving in. All in all, in a nutshell, it begins with streamlined workflows, being able to monitor and measure critical activities, and to correct problems moving forward so they don't keep occurring. It's about efficiency, taking advantage of automation whenever possible, identifying root causes, and working in a state of continuous improvement. Now, I fully understand that this is certainly no easy task, But I do believe that having trusted tools and solutions can really help. And we're going to show you some of these tools today. Next slide, please. So I talked a little bit about some key things that go into creating a best practice revenue cycle and working with practices of varying sizes kind of across the country. We've also identified some common themes and revenue cycle challenges that really seem to resonate with most everyone across the board. And the first one is that data analytics and key performance indicators. These are really important tools for monitoring efficiency and for problem solving, but they can also be time consuming to create, and they're not always easy to calculate. I think most everyone that I've ever discussed KPIs and dashboards with really wishes they could simply push a button and have their trended metrics magically appear. Most practice management systems I've worked with have some sort of reporting capabilities, but getting summarized and trendable metrics often requires running detailed reports, printing them or exporting them to Excel to find out things like how long it's taking to submit your claims, what kind of denials are being received, or to identify trends in services that remain unpaid. This is a lot easier for someone who enjoys working with Excel and reporting and things like that, but not so much for those who have tight timelines and prefer to leave Excel to the finance and reporting experts. And when it comes to a rheumatology practice's highest expense, the medications you're administering to your patients in the office, not having a mechanism to reconcile those administrations with your claims and making sure that all your services have been billed, that could really result in a significant financial impact. Not monitoring this information really can leave potential opportunities for improvement unaddressed. So a second challenge is that reimbursement from payers is not keeping up with the cost to run a practice. Payer contracting is probably a key want-to item on most every administrator's to-do list, but more often than not, it gets put on the back burner due to more critical issues that need to be addressed. There are always fires to put out in a medical practice. And payer contracting takes time. It takes a lot of time. From completing an initial analysis to determine, what contract you actually want to renegotiate, all the way through the back and forth processes of negotiating with that payer. And unless you've got a dedicated person on your team to help take this project on, it's challenging to accomplish. Nonetheless, if you don't do it, it's likely money left on the table. And then number 3 on my list of challenges is that the prior authorization process is complicated. And that's probably an understatement. But it requires a structured workflow by someone who understands the ins and outs of your particular specialty to make sure every single treatment is reviewed against patient benefits and payer guidelines to make sure the medication is, number 1, covered by the patient's insurance, and number 2, that a valid prior authorization is in place. Working through the prior authorization process also requires a specialized skill set that sometimes can be hard to find. In my experience, prior authorization specialists are organized, they know their way around the payer websites, and they also understand the medications and services they're authorizing. But in the case that your specialized expert decides to move on to another opportunity, and sometimes that happens, finding someone to pick up where they left off can really present a whole new set of challenges, especially if their workflow wasn't documented and well managed. And we all know that not following payer guidelines or obtaining an authorization when required will more times than not result in denied claims and services that are never going to be paid. All in all, the revenue cycle is complex, and the challenges you're all faced with today are not going to get any easier anytime soon. Finding technological solutions and creative ways to keep your finger on the pulse of your AR is really critical. So to address these challenges, we're going to look at 3 specific technology solutions that can help you strengthen your practice's revenue cycle. The first one is Advanced Practice Analytics, also known as APA. It's a cloud-based application that provides awesome insights to help you monitor your revenue cycle performance. We're also going to take a look at a great payer contracting solution. Cardinal Health, in collaboration with a company called Payer Health, provides practices with a wealth of knowledge and experience to assist with practice payer contracting needs. And then last, we will showcase how to simplify the prior authorization process through workflows and automation using eBlue solutions. Next slide, please. So first, let's take a look at advanced practice analytics and see how you can get easy access to important revenue cycle data and track some key performance indicators. Next slide. Thank you. As I mentioned previously, advanced practice analytics is a cloud-based solution that combines data from multiple sources in your practice. So this includes purchases, medications administration that have been dispensed, claims and remittances. And by combining all of this data, it provides value not only through visibility into revenue cycle related activities and performance metrics, but it also offers considerable time savings for those responsible for running your reports, for combining disparate information, and for reviewing the results. And it's all in a very user-friendly format. Next slide. So APA receives your data on a daily basis, including your electronic claims and remittance files. And this is so the insights you gain are current and up to date. The tool is very, very robust and can be used to capture a wide array of information, really depending on your individual needs. And because it contains both dispense and claims data, it is great as a reconciliation tool for making sure you bill for every treatment delivered to your patients, which is always, always a significant concern in a rheumatology practice. And what else it can do, it can compare your billed and allowed amounts and isolate any services where the allowable was 100% of the charge. So this is a super easy way to identify where you might be inadvertently leaving money on the table. And whether you're looking for performance metrics or you're problem solving, the comprehensive filtering capabilities in APA allow you to drill down and focus on exactly what it is you want to see so you can take action. Some of these filters include date ranges, location, provider, payer, service type, and procedure code. I could go on and on. Actually, really, you have the ability to slice and dice your information any way you want. I honestly don't believe I've ever come across a filter I wanted to use, but wasn't available in APA. A great example of where these filters might come in handy would be in the one module called margin analysis, where you can filter by a specific drug or HCPCS code for a period of time, and then compare how all of your payers are paying you. So you could even do the same. You could even do the same thing and compare a reference product, for example, to a biosimilar. All of this information, again, is available at your fingertips, since the difficult part of combining that data is already done for you. Advanced practice analytics is really an excellent decision support tool. Next slide. So APA has multiple modules, and one of the most popular with our customers is called reimbursement management, and that's what you can see here. As a revenue cycle leader, this is probably most likely where I would spend a lot of my time. And it's actually one of my go-tos when I'm helping customers research a problem. So what we're looking at here is the landing page for reimbursement management, and key metrics available right on the summary page include your clean claim rate, your total allowed amount, your total payments, and patient financial responsibility. And this would be for whatever date period that you have filtered by. Also located here are some charts that show you your payments by payer, your reimbursement by procedure code, plus how long on average it's taking you to get paid. So all very useful to have on a dashboard to quickly be able to gauge your overall financial picture at a glance. In addition to this high-level summary dashboard, APA has a wide array of other tools and functions available. And one of them in particular I want to highlight is the ability to compare your overall reimbursement to Medicare. So APA contains current Medicare rates, allowing you to see how your payers are performing as a percentage of Medicare. These rates are loaded for you as a default, but you also then have the option to upload your other payer contract rates for easy contract variance identification. This is an excellent way to monitor your payer compliance and make sure that they're paying according to the contract. So the last thing I'd like to highlight about APA is that as a denial management resource, it is absolutely phenomenal. And I would have to say that this is one of my absolute favorite features of advanced practice analytics. And I think this is because when I was a revenue cycle leader, capturing denial summary information was just extremely difficult without a whole lot of manual work and data manipulation. You know, they say cash is king, and knowing how much you're being paid is really important, but just as critical is understanding what you are not getting paid for and why. And being armed with this information about your denials really allows you to identify where your biggest risks are, and where you need to focus your improvement efforts to really ultimately improve your cash flow. To piggyback on this piece from a denial perspective, an additional denial management resource is our denial tracker, which looks at your historical denials and shows you what is still not paid. So this lets you see what's unresolved and possibly catch a high dollar claim that may have been overlooked by your team. It also can help you see how effective your billing team is at resolving your denials. Plus, see, it's really great. Plus, it converts those outstanding charges to estimated allowed amounts so you can understand the true financial impact of not getting those claims resolved. All of this, again, at your fingertips with the ability to drill right down to the problem claims so you can fix them. Honestly, with APA as your denial resource, you're able to quickly identify what services are being denied, who your problem payers are, and what the root causes are. It's truly a great tool to keep track of your denial management issues. So in summary, I guess I would say that advanced practice analytics provides easy access to an incredibly robust data set, allowing you to gain insights into the inner workings of your revenue cycle to drive decision-making and truly improve your financial performance. And now I'll turn it over to Robin Brown to talk about payer contracting.
Thanks, Heather. I appreciate it. So payer contracting is a solution that's fairly new to Cardinal Health. We launched in several therapeutic areas maybe about a year ago. So let me talk a little bit about what that means. Next slide, please. So payer contracting is a consulting solution that layers on top of our advanced practice analytics platform. So what that means is we take the advanced practice analytics technology platform that Heather was just talking about, and we take those insights gleaned from that platform, and we work with a partner called Payer Health to really bring forth a fully sort of end-to-end outsourced payer contracting solution for your practice. I'll talk a little bit about Payer Health. Payer Health is a partner that Cardinal Health identified when we decided we wanted to offer this service. We looked at several models for delivering payer contracting services, and knowing the complexities with geographic and therapeutic area differences, we decided our best bet was to bring in an outside partner. We looked far and wide and ended up deciding that Payer Health was the right partner for us because of their depth of expertise, wealth of knowledge, and just strong clinical and financial and other knowledge. Payer Health has a lot of experience in rheumatology. We have several case studies that we worked on together and that they've worked on before they came to Payer Health. So that's one of the areas that we like to bring to kind of front and center so that you're aware that this is not the first time they've been doing this. They're very experienced and they have a whole process set up for this. The way this service works is that you meet with a team. We do an onboarding process. Again, as I mentioned, this layers on top of our advanced analytics platform. So we get you signed up for advanced practice analytics. Then we sort of work through what your needs are, whether it's kind of an assessment, understanding which year contracts could use some work. That's one service that we offer. Maybe you have a particular contract in mind or a series of contracts. So we work with you to sort of to define the project. Then Payer Health works with you in your practice to put together sort of a report or a series of materials that they'll use to work with the payer to contract better rates. And then they will take that case and they will really do the payer coordination on your behalf. We're really proud of that because it's a way of taking this off your plate. Of course, your practice can be as involved as you want to. If you'd like to be on calls with the payer, be copied on emails, you're always welcome to do that. But Payer Health really can free up some time in your practice if this is something that you've been meaning to do but maybe haven't had time for. Payer Health offers regular sort of check-in calls so we can talk about how things are going, work through any hurdles, and really focus what's most important to you in the negotiation. And in the end, though it takes some time, they're typically able to deliver an improved contract that you then keep into the length of that contract, which might be typically 2 or 3 years or whatever that payer dictates. there's some changes here. There's some sort of specifics depending on your state or depending on your needs. But that's really what an overall contract renegotiation looks like. And again, just to kind of recap, services include that payer portfolio review, negotiations and renegotiations. I talked a little bit about renegotiations, but of course, if you're a fairly new practice or there's a new payer you're looking to get in with, that's something Payer Health could help with as well. They also can help with contract terms and reimbursement summaries, and then help with proactive contract monitoring and maintenance. So really it's a one-stop shop. If you have any questions about payer contracting, feel free to reach out to your sales rep at Cardinal Health, or follow up after this webinar, and we can always provide more information about your specific case. Next slide here. I touched on this a little bit when I talked about sort of the makings of a payer contracting engagement, but some of the benefits include freeing up your staff's time. I think every practice probably knows how important these payer contracts are. And maybe it's been on your to-do list or you've started contract renegotiations or negotiations, but they can be really time consuming. They typically take several months. And to be really diligent about getting these done can take some time. So that's, one way that Payer Health can really take that off your plate and hopefully get you some good results. Payer Health can also help you build strong payer relationships. They have, they come to the table with a strong kind of book of contacts in the different payer or different payer relationships, I would say, across the industry. And they can help you with some of those relationships that you may not have yourself. They can also help cut through complexity. Perhaps you have new staff or payer contracting isn't necessarily in the realm of expertise of your practice. So of course, they bring in their deep expertise to really help you go after better contracted rates. They also have access to data. So some of their own proprietary benchmarking data, they bring in third-party benchmarking data, and then of course, all of that powerful data from advanced practice analytics to really help you make a strong case and go after, the best rates that are available to your practice. Next slide. And now I'd like to talk a little bit about a pilot practice, a test that we conducted with Payer Health and a practice called Rheumatology Associates. I'm going to turn it over to Rosie Walters, who's the lead of that practice, in just a second here. But wanted to say that we're really proud of the results of this. Again, before Cardinal Health decided to launch this service to our practices, we spent a lot of time working with payer contracting, refining the offering, making sure it would really work for our customers. And this customer perspective, this case study is really a result of that hard work. And with that, I want to turn it over to Rosie to talk a little bit about her experience with Cardinal Health and Payer Health and our payer contracting service.
Hi, thanks for joining us this afternoon. Well, Robin kind of covered a lot of what I was going to say. Thank you, Robin. So I guess if I'm looking at this slide, my question would be, where did these numbers come from as far as achieving this $642,000 worth of savings? So when Cardinal approached me about this, it came at just an opportune time. I don't know if you all remember United Healthcare sending us those great letters that they were cutting everything and, you had 30 days to respond and all that. So obviously that was the first place we started, was with United Healthcare and them renegotiating for that. So we started off with them sending a letter to United Healthcare stating that we are not accepting the new contract. We want to renegotiate. That is probably something I couldn't have done on my own or gotten the benefit of them being able to do that for us. Overall, working with Cardinal and Payer Health through all this, it was a great experience. We did have weekly check-in meetings. With that being said, we're all so busy. They were always very respectful of the time. So they were literally 5 and 10 minute meetings, got to the point, so we had to say, and did it. As Robin said, them collecting the data and the analytics for us was just phenomenal. We'd all like to do this, but do not have the time to do this. So that was great information, helped us with negotiating our contract and what our expectations should be for this contract and what we should expect from them. So lost my train of thought. So I'm sorry. The other thing Payer Health did with us is if we had any other issues going on, because as we're waiting for our contracts to be approved, of course, they're not in a hurry. They don't want to raise reimbursement. They also reached out to us and said, is there anything else during this time that we can do for you? So what I asked from them was to get me contacts at all the insurance companies. It used to be we all had our reps and we knew who to go to, and that's just not the case anymore. But they were willing to and able to get us contacts at all our major insurance carriers, which has worked out great for us. Also got on calls with us if we were having other issues with payers that we were working with, such as problem with something not being reimbursed correctly. They would do a three-way call with the insurance company and help with that. Overall, I don't think we would have gotten the contracts that we got. We did United Healthcare and then moved on to Humana after that. I have no doubt that we got better contracting going through Payer Health and the Cardinal program than we would have on our own. Thank you.
Rosie, yeah, Rosie, do you mind if I just ask you, we're running a little bit ahead of schedule, and it's so valuable to hear from someone who's been on your side of one of these engagements. So not to put you on the spot, but could you talk a little bit about the amount of involvement, like how much time this took? I know you said it was 5 and 10 minute phone calls kind of later on, but how much time did it take in the very beginning when you started working with Payer Health on the engagement?
Yeah, not a lot. I did have to send them obviously some information. One thing I wanted to mention, of course, one thing they ask you, and everybody has something at their practice that they stand out for, right? So when you're negotiating a contract, that's what they ask us. What stands out at your practice? What can you say that your practice does that other practices do not do? So something to think about when you get started. We all have them. Might take us a little while to figure it out, but we all have our things that we do better or do differently than someone else. So I would say in the beginning, a couple hours, but like I said, very respectful of your time. They know we don't have time to do this. This is why they're doing it for us. So, I would say a couple hours gathering information so that they could then put our data in where we could see what was going on. Basically, we have the data, right? But it's just putting it in a format that we can use it.
Yeah, absolutely. And then prior to working with Payer Health, when had you tried to renegotiate contracts on your own before, or was this something kind of completely new? Had it been a few years?
Yeah, we had not in a few years. We had negotiated in the past. It is just very time consuming and takes you away from other things you need to be doing. I think the other benefit of Payer Health is, we can't discuss our contracts with other people. However, they're negotiating a lot of contracts. They can see what is a reasonable reimbursement or whether they are, basically under reimbursing. So that's very helpful to have somebody that's out there has negotiated several contracts and knows what basically the going rate is, right?
Mm-hmm. Yeah, I think that's a really good point. I think, when we were selecting and kind of narrowing in on the pilot practices that we would work with, we chose you because you're really savvy. I mean, you know your rates, you know how to work with the insurance companies, but sometimes it's just about finding time to do it, and really putting some diligence around it. So that was one thing we appreciated working with you on is you made yourself available, but it was probably less time consuming, or just easier to focus when you've got a third party that's project managing this, kind of telling you what to do, holding your hand through the process. Is that kind of a fair statement?
Yeah, and I would say, them bringing up things you may not even think about, consider that would be good information to give them, to help with the reimbursement rates.
Yeah, absolutely. Well, thanks. Sorry to go off script a little bit, but I wanted to, I wanted to bring that in because it was just a pleasure to work with you, and we appreciated you, being part of this project and kind of being willing to speak on our behalf.
Absolutely. And real quick, I'll give a plug for the analytics. However, I haven't got into it as much as I would like to because of time, but I have caught several things on there that I probably would not have caught. So I will give them a plug while we're on there.
Yeah, absolutely. I mean, advanced practice analytics is a great tool. And it was something we know it provides all these insight, excuse me.
Right.
And like I said, I come from a payer contracting background, but sometimes it takes, having that extra step, knowing now I'm working on my contracts to really log in and make a point to use APA, because we're all busy, right? We've all got phones to check, emails to check, computers. Feels like a million things we're trying to stay on top of. And so sometimes having an engagement like this, saying I'm really going to focus on this for the next X period of time, really gets you logging in and kind of putting those analytics to good use. So thanks for saying that. I appreciate it. All right. With that, Heather, do you mind if we turn it back to you? We'll go to the next slide. I think we're on to our prior authorization solution.
Yeah, thanks, Robin, and thanks, Rosie. So talking about prior authorization, as I mentioned earlier, prior authorization is complicated and requires a streamlined, organized workflow. I'm really excited to talk to you all today about eBlue Solutions and how it can help you accomplish this and get your patients on treatment more quickly. Next slide, please. So although there's been some buzz in the healthcare industry regarding legislation to reduce payer prior authorization requirements, it seems that most of the attention today really has been focused more on procedures and then with medications. What this tells me is that prior authorization for the administration of medications in rheumatology practices is not going away anytime soon. And with the current wave of rising costs and declining reimbursement, we really all have to continue our due diligence to make sure that payer and plan requirements are met before treating patients. I remember a time when we just had to understand payer-specific medical policies and which medications and services required prior authorization, because not everything did. But with the prevalence of specialty pharmacies and new treatments coming to market, really these have added increased layers of complexity to the process, making it more difficult to follow those rules. And everybody wants to follow the rules. So I know you're familiar with these challenges firsthand. And even before you begin the process to actually request an authorization, a series of questions need to be answered. Things like, is the patient's insurance coverage effective? Does the insurance plan cover the medication that was ordered? And if it does, what kind of financial responsibility is the patient going to have? And will they need assistance to help cover that cost? Also, you need to know, does the patient's benefit plan actually allow buy and bill, or does the medication need to be obtained through a specialty pharmacy? And finally, are there step edits in place that require the patient to try an alternative lower cost medication first? Then finally, once all that's done, you can navigate to the payer specific form or portal to begin the prior authorization process. That definitely is a lot of steps to manage and keep track of. The good news here is that eBlue Solutions offers a cloud-based workflow that helps you manage the entire prior authorization process from beginning to end. Next slide, please. So eBlue is a single portal where you can keep track of the entire prior authorization workflow for all your patient treatments and also take advantage of available technology. It really starts with an upload of your patient demographics, insurance, and treatment information. And from there, you can run an eligibility and benefits investigation. You can connect to payer-specific prior authorization processes through portals or pre-filled forms. You can track your PA status, and you can also monitor for expiring authorizations. In some cases also, depending on the medication, eBlue will provide assistance with completing the authorization on your behalf, including performing regular queries to obtain approval results. We know that you can submit an authorization and you're not always going to get that immediate approval. So you do have to go back and check to see if it's approved or not. All in all, it's an end-to-end solution that can help you follow the rules, expedite and manage your prior authorization process, and help ensure you get paid for these services being provided to your patients. And the best part of it all is that eBlue is offered at no cost to you. So now I'm going to hand it off to Chris Cagle to share her experience with eBlue's prior authorization solution.
Thank you. Our practice began using eBlue in 2019. Due to our location, we see patients from Ohio, Kentucky, and Indiana with a diverse range of employers and insurance carriers. We started off slow, utilizing their benefit investigations for 3 medications. The onboarding process was awesome. We met with eBlue representatives, went over the portal, the different ways to submit patients, and receive training on the portal. Any problems or questions we've had with patients' benefits are cleared up with a single secure message within the portal, which is answered very quickly. As time flew by and biosimilars arrived, it was a no-brainer to add those meds to our eBlue portal rather than starting new portals from those manufacturers. So in November of 2022, we moved all of our infusion medication verifications over to eBlue. It's been a huge time saver with a one-stop shop for all of our medications. Their verifications are returned consistently on time. They are clear, concise, and easy to understand. And rather than having to read through the small print and interpret benefits, any issues such as no buy and bill or PA required have a big red X at the top of the benefit verification. That's really hard to miss. So making the decision to switch over to eBlue was definitely a great one for our practice.
Thanks very much, Chris.
Fantastic. We'll go to the next slide. So really, as we wrap up here, I know we spent a lot of time talking about, technology solutions. So that's our advanced practice analytics, as well as our revenue cycle management services, prior authorization and payer contracting. And I want to just talk about overall kind of Cornerstone and Cardinal Health solutions for our customers. We really want to be a one-stop shop. We'd like to be seen as sort of an expert in this space and helping you not only get the pharmaceutical products you need to run your practice, but also in offering the services to make your job a little bit easier. Most of our team comes from, various backgrounds. We've sat in your shoes. We've worked for practices. That's a lot of our sales folks, as well as a lot of us that sit on the consulting and technology teams. So it's really our goal to bring a full suite of solutions, again, to make your day-to-day life a little bit easier. So some of the other tools that we include, we didn't necessarily talk about today, but it's our Cornerstone rheumatology, GPO contracts, and dashboards. So we offer tools for you to get great financial insights about your practice. So that's, everything from a tool that allows you to see where you are in certain spend tiers when you're buying drugs, and how you can really optimize and hit those next rebate tiers. Different dashboards to look at, again, your claims and remit data. That's our APA. We even offer some tools to help with dispensing and sort of storing and tracking your medications. Cardinal Health offers medical and surgical supplies. So again, we like to be your one-stop shop. We can help you with the gloves and the needles and all the other things that really help your practice run. We also offer biosimilar education and industry expertise. I know that's a hot topic with all of the new biosimilars coming to market. So kind of check us out. We offer different webinars. We have a really strong kind of pharmacy team that can help you navigate what biosimilars might look like for your practice. So, follow us on LinkedIn or kind of look out for other ways you can learn about biosimilars and those changes. Again, I talked a little bit about those technology tools and revenue cycle management solutions. We spent some time on that today. We offer nationwide distribution. So that's everywhere. I think we've even got some customers in Alaska and Puerto Rico as well. And we even offer a cooler return program because we know that packaging can be kind of a headache for some practices and what to do with all that packaging your pharmaceutical products come in. And then last of all, it's personalized support. So again, you have, a sales rep that's assigned to you that can answer your questions. That's really the place to start when you want to learn about all of these different solutions. But we also offer, a full technology support team. So we have a highly trained team of engineers that sit in Ohio and can answer questions about any of the tools we spoke about today. So you're never alone on an island trying to figure out these different tech solutions. In fact, you typically get assigned a technology account manager when you sign up for our technology solutions, so that you've always got somebody to call when you're trying to navigate these different solutions. So again, our goal is really to be kind of that one-stop shop to help you navigate the complexities of running a practice and help you do it as seamlessly as possible. So with that, I know we finished, or we're about to finish kind of the presentation part of the conversation. So I'll turn it over to Andrea to wrap up and then offer some time for Q&A.
Thank you. I think that was very helpful for all of us. We do have a couple of questions, and I'd like to start with, first of all, just my question. I'm from a small rheumatology practice, 2 docs. Does Cardinal work with larger practices, or are there ways that you could work with smaller practices as well?
Oh, absolutely. Our customers range in size from the single practice where it's maybe the wife is the doctor and the husband is the practice manager, all the way up to large enterprise practices. And again, we've got experience and kind of tools for all those practices. Again, the best place to start is kind of reach out to us, and your sales rep can help navigate. Maybe all of these solutions aren't something you're looking for today. But maybe it's, 1 or 2, and you can kind of create that custom package that would allow you to operate your practice. So it's a good question, Andrea.
Yeah, that's really helpful, Robin, because sometimes even as small practice managers and small offices are wearing so many hats, it's really hard for us to find that time. So I'm sure there's many practices that would appreciate that.
Totally. And you never need to sign up for everything all at once. Sometimes maybe it's, hey, we're interested in 1 or 2 of these items today, and let's talk more later. That happens all the time, and we're happy to have those conversations, but sorry to interrupt.
That's okay. So in that same tone, how long does it take to renegotiate a payer contract?
Yeah, so this can be kind of a long process. It really depends on the payer. Typically, we ask you to start with a 9-month contract. And I don't want that to scare you away, because that entire 9 months is not very labor intensive on your part. Kind of what Rosie said in the beginning, it's, a few hours here and there, pulling together all the information that's used to kind of create your case that's then used to renegotiate your contract. But it becomes a little bit less labor intensive on your practice's part as the negotiations take place. Because again, the team of consultants at Payer Health really takes it off your plate. So long story short, I would say we've had shorter than 9 months. We've seen that. We've had it take a little bit longer, but I would plan on the better part of a year, just because of the nature of the practice and working with our favorites, the payers.
So I'm sure it also depends on the payer and how quickly they respond as well.
Yeah, absolutely. And there's always a holiday. There's always 4th of July or Christmas or some sort of delay that's keeping people out of the office. So we joke about that a lot, but that tends to add to some of the length.
Yeah. So what is the cost for the payer contracting services that Cardinal provides?
Yeah, so Cardinal Health was able to negotiate kind of proprietary sort of special pricing for our GPO customers. That's in large part because we, again, require the use of advanced practice analytics, which really makes this process a lot easier. It takes all of that claims and remit data, which is really kind of the backbone of the data and analytics in one of these cases, and packages it nicely and makes it a little bit easier to work with the payers. So you're looking at typically in the range of about $1,500 a month for one contract, but there's some variability based on number of tax IDs. We also offer some different packages. Maybe you don't know where to start. Maybe there's a problem with your contracts, but you don't know which one you'd go after. We have some packages to help with that too. Really the best way to get started is, again, kind of reach out to your sales rep. Your sales rep can set up a call with Payer Health, and then we can help you navigate what package might be best for your practice.
I do see a question here for a contracting about, does Cardinal contact the payers for the negotiation on behalf of the practices, or did the practice start the process?
So Payer Health will contract payers on your behalf. So again, really taking the whole process off your plate. But of course, if there's a reason why maybe you wanted to kind of keep that in-house and you just wanted them to kind of guide you through the process, they could work with you on that. So there's some variability, but yes, they can handle the whole process on your behalf.
Okay. And then when we go on to eBlue, Pamela has asked us a question: how much time was involved in initiating eBlue, getting it started in the practice?
Yeah, hey, I can jump in and answer that. So, I think it varies depending from practice to practice. So it's really, because it's a portal that you access, you don't have any technology set up yourself. So it's really about how quickly you can get your staff trained, get your patients in there, and then move forward. So really not a lot involved in getting that set up to move forward.
That's great. Can you explain?
Oh, go ahead, Andrea. I was just going to say, could we Chris, again, I don't want to put you on the spot, but would you be willing to talk a little bit about your practice's experience with this, just so we could kind of hear firsthand about, you know, working with eBlue and just sort of how much time it took your practice?
Sure. So I would say the amount of time involved depends on how many patients you have. eBlue was great with us. We all of a sudden had to move one of our medications over to eBlue. They kind of just came to us and said, we're not going to do your verifications anymore. So I talked to eBlue. They told me to give them a spreadsheet of the patient information that they needed. I shot it over to them. They entered all the information in the portal for us. And they set up training so that we knew how to navigate through the portal. We had someone leave the practice. And when I filled that position, they offered training for that employee also.
That's really helpful. Thank you so much. It was good to hear kind of firsthand from someone who's been through the practice. You know, we know how it's supposed to work from our end, but it's always a little bit different when you're actually in the practice and trying to manage the day-to-day as well. So that's really helpful. Sorry, back to you, Andrea. I know you maybe had some other questions.
I do have one other question for you, Robin. How is eBlue different from using like the patient portals or the patient access tools that are offered on the manufacturer's websites?
Again, actually, Chris, would you mind speaking to this? And then I'll turn it over to Heather as well. Because again, I think while we've got you, it's great to hear kind of from your shoes. I'm sure you've worked with manufacturer portals in the past.
Sure. So I would say one of the big differences is each portal is different. So the way the benefits come back from one medicine versus another always varies. eBlue is all the same. It's going to be the same outline, and things are going to be in the same place, whether they need a prior authorization, whether you can or cannot buy and bill. They give information on how to get the prior authorization. If you need to fax something, the fax number, how to check on it. It'll also come back if maybe they have Medicare Part A, and it'll be highlighted at the top, and you scroll down and you can see, oh, they have Medicare Part A. Or sometimes somebody has a copay rather than having to satisfy their deductible and out of pocket. That's all written out for you. When you use the manufacturer's portals, every portal is different. And I think one thing I liked also is we know how hard it is to maintain all those portals, the passwords. Every couple of months, I'm changing passwords for every portal. With eBlue, I have one portal. It's one stop. So on Mondays, what we'll do is we'll submit our whole entire schedule for the next week. We key all of our stuff in manually. You do have the option, if your system can download to a spreadsheet, just sending the spreadsheet to eBlue and they'll upload it themselves. So it's really, to me, it was so much easier instead of going to multiple portals and entering information different ways. My new employee that came in, I could teach her one portal. Everything is there. I could train her how to look at a benefit verification, how to pick out the information that's most important, and definitely not to miss information that's very important.
So Christine, I have a quick question for you. I know many practices, you know, now that we're into May, we're way past the blizzard. But did you use eBlue to do your benefit investigations during the blizzard? And for those that don't know what that blizzard is, it's that time at the beginning of year in January through probably March, where we redo all the benefits for all the biologics or all of our patients that come into the practice.
We did. And I will tell you, this year was the first year that I used eBlue for all of my medications in the blizzard, and it worked fantastic. By probably the first week of December, I had to have my entire January schedule uploaded. So that wasn't a problem. We just gave them all that information. Our office was closed this year on January 2nd for the holiday. I decided to come in. eBlue had tons of verifications. They were already working on New Year's Day, running benefits. I caught all of those people who decided it was a great idea to switch from Medicare and a supplement to an Advantage plan that, you know, those people. So it was great. So a lot of the times, if you use the manufacturer's portal, you don't get any benefits back till probably the 10th or the 15th of the month. With eBlue, I got them back on the 1st of the month, on January 1st. So everybody that we had scheduled on January 3rd, I had all their benefits back on January 2nd.
I know that's really stressful time for us, getting all those benefit backs. So that's great to hear. I have another question. What is the cost for prior authorization services through eBlue?
There's no cost. eBlue is free to use. They have sponsored medications, which pays for their services.
Okay. And I'm not sure, Christy, this isn't directed at you, but maybe Heather or Robin. What is Cardinal Health's relationship with eBlue?
So I'll jump in. So Cardinal Health is actually collaborating with eBlue to bring a prior authorization solution to our customers. Prior authorization has been an ongoing challenge for practices, and we at Cardinal, recognize that with our customers. So we just really wanted to find a way to help lessen this burden. So what we did is really looked at the market, found out what was out there in terms of vendors, and vetted them, and really came upon eBlue Solutions and decided this was the best solution for our customers. And one of the primary reasons is because of their deep expertise in rheumatology.
Okay. And then one last question is, between all the services that Cardinal does offer, is there any specific EHR or PMS vendors your solutions are compatible with?
So Cardinal Health has a full integration engineering team that sits at Cardinal Health. Most of the engineers sit in Ohio, actually. And so we can work with any clearinghouse, any EHR, any PMS provider. We see TSI NextGen. We see a lot of the common platforms that use in this area. Our team is open and has worked with most of them. One thing that I kind of mentioned is that we have a full staff that supports all of our integrations and applications. So if you have questions about different, clearinghouses or different other technology providers that you're working with, we're happy to meet with them. Our team, if you make an introduction, and then our team will meet with those providers and make sure that, if there's any costs involved or any special processes, that we're able to accommodate. So really flexible. And we know that's kind of one big area that can be a cause for some concerns. We try to help take that off your plate and handle that piece for you if there's questions at your practice.
Great. And Christine, I think I have one more question for you. So Pamela asked, do you find eBlue a better tool than having an associate make phone calls to the specific carriers?
Oh, definitely, yes. It saves us tons of time.
Thank you.
Fantastic.
That's all the questions I have in the Q&A. Any final questions, please type it in quickly.
Well, we're waiting to see if anyone else has questions. I wanted to jump in, and again, Rosie, put you on the spot one more time here. I know you mentioned that we started your payer contracting engagement as a pilot, and that was working with, I believe it was United. And then you mentioned also working with Humana. Can you just speak to going from pilot to actual customer? That was a decision your practice made, right? You were happy kind of with the result of the first. Okay.
It was, yes, it was. So we did have such good results from doing United Healthcare. We chose to go ahead and have them do Humana under a contract with them. I don't know that it was any different. It worked the same as the pilot did. Except that I had to pay, I'm sorry. But that was a problem, but no. To Andrea's point, when you're asking about pricing, it is hard to make a decision to say, okay, I'm going to spend $1,500 a month. And a lot of the time seems like you're just waiting. But I'll just reiterate, I do think it's worth it in the end. You have to think of your overall reimbursement, and that's, on a daily basis, making sure you have the best reimbursement. So although the $1,500, I think, might seem a little high or unattainable for some practices, I do believe it's worth it.
Thanks so much, Rosie. I'm glad we got to touch on that. I meant to ask you when we were when we had you on the spotlight earlier, but I think it looks like in the chat here, we maybe had one more question about eBlue. So I'll turn that over to either Chris or Heather. But can eBlue do benefit investigations for sub-Q and meds? I don't know if you're able to see that in the chat, but
to
Heather,
my
can you answer that one?
knowledge, they cannot. I've
Okay.
asked about that before, and I think that's something that's coming in the future. But right now, we're only using them for our infusion medications. Some of the injectables that we do in the office, we use them for, but nothing through pharmacy.
Okay. Anything you'd add to that, Heather?
No, nothing to add. Thanks, Robin.
Okay, perfect. Yeah, and I will say eBlue is great. They're always willing to kind of take feedback into account. So I would imagine that that's something that's on their radar. Can't promise a timeline or anything like that, but always worth having a conversation, for existing customers or future customers, if that's something that's really important to you. So kind of with that, I think we're at the end of today's webinar. Andrea, do you have anything to say as kind of final parting thoughts?
No, I just really appreciate the partnership. And I just wanted to thank our panelists and Christine and Rosie for sharing their experiences. And please remember that there is a brief, one quick question survey. So please take the time to do that. It's greatly appreciated. It should be on your screens now.
Thanks so much, Andrea. And I just want to say on behalf of Cardinal Health, thank you so much for having us. If you're an existing customer, thank you. We love working with you. And if you have questions about any of these services or potentially becoming a customer, feel free to reach out online and we'd love to have a chat and see if we could help out. So thank you all.
Your